There has been no shortage of warm weather this year, but the higher temperatures have come with a cost, a longer and stronger pollen season. For many who suffer from seasonal allergies like myself, symptoms have been worse than ever. And even people who don't usually have much of a problem during pollen season, well, they have started to feel its effects. So what does the rest of the spring have in store, and how can any of us fight the worsening symptoms? Well, we're hoping to get some answers here today. I'm joined by Kenneth Mendez, President and CEO of the Asthma and Allergy Foundation, and Dr. Anna Wolfson, allergist and immunologist at Massachusetts General Hospital. Thanks for joining us.
Great,
Hi,
thanks for
happy to
having
be.
me.
All right, so Dr. Wolfson, I'm going to ask you, what are you seeing in your office nowadays? Because it seems like everyone I know is talking about sneezing and sniffling and everything in between.
Yeah, exactly as you've said, we've seen so many patients with runny noses, congestion, itchy eyes, and flares of their asthma. It's been a really rough pollen season this year so far.
So is this something that you gear up for, like seeing the forecast or seeing some of these trends here, and you're thoughtful about that in your office and in your practice there?
Yes, absolutely. As the pollen season comes, we add in more clinics, more shots, slots for patients, and also we anticipate that more patients will be seeking out our advice and our care. We also realize people will be calling with more questions, so we have nurses available to answer their calls and their messages. We know especially our asthma patients often have many questions for us.
Well, speaking of Kenneth, I'm thoughtful of this as well. I have asthma, and every time my allergies kick up, my asthma kicks up as well, and that can be a real concern for folks who are just trying to find some relief somewhere.
Yeah, there's something called allergic asthma, which can be a trigger, which allergies, seasonal allergies, can be a trigger for that allergic asthma. And what a lot of people don't realize is that over 3,100 people die each year from asthma. So it's really important to see someone like Dr. Wolfson. We always recommend see a specialist so you understand what your triggers are for your asthma and you can deal with that. And in the spring allergy season, the allergy season throughout the year can be a trigger for that for certain types of asthma. We've found that the allergy seasons are getting longer and more intense, and the pollen releases are more intense because the additional carbon dioxide from climate change. So that supercharges these releases. And then if you're in an urban area in particular, there are these urban heat islands where the average temperature is close to 4 degrees more than outside the urban areas. So it's a lot worse for people in urban areas as well.
Well, I was going to ask you, because we were looking into some information and found that, a lot of the major Massachusetts cities actually see an uptick in these cases of allergy and asthma over the last few years.
Yeah, I mean, definitely Dr. Wolfson would know that. She just spoke about that. But we do a report called Allergy Capitals. We look at the 100 largest cities and the ones that are most challenging to live in with allergies. And there are 3 criteria that we use: pollen counts, access to specialists like Dr. Wolfson, and then over-the-counter medication. So your rank in there will be based on your access. Now, actually, Boston ranks quite high in terms of access to specialists, so that's good. But in other places, there are higher pollen counts, either tree pollen or over-the-counter medication usage. So that's why some of the rankings fluctuate each year.
Dr. Wolfson, how does this year compare to perhaps years past?
It is much worse this year. Both anecdotally, we've seen our patients really suffering, asking lots of questions about what to do when they have very, itchy eyes, runny noses, congestion, and asthma symptoms. And we only anticipate this continuing on into the future. Once the symptoms begin, they really kind of carry on and build on themselves. So this is something we need to prepare for this season and ongoing into the future.
I'm also thoughtful of, we mentioned folks who may not have experienced allergies in years past, and this season was particularly bad for them. What if folks are concerned that it may not just be allergies? Maybe it's COVID, maybe it's another infection. And I know that sometimes folks get concerned when they start sniffing and sneezing and they don't normally do, that it might be something very serious.
Of course, fever is not a symptom we would expect with allergies, so that would be a sign. And of course, taking a COVID test would be the first step. But if you're confused, unsure, seeing your primary care doctor and even an allergist can be really helpful to discern these different symptoms.
I'm also, yeah, go ahead.
I would just add one other slightly different angle, but the doctor can confirm this. I think with allergies, it's your total allergic load in your system. So a lot of people are coming in saying they've never had allergies before, or their allergies feel a lot worse. And I think because there's more pollen release and you have these longer, more intense seasons, if you never had allergies before, because of the additional pollen and these allergens, you're now starting to react because your body has started to reach that threshold. So per what Dr. Wilson was saying, that's why some people are feeling these symptoms and maybe they never had them before.
How do we, well, first, let me ask you this, because I know that albuterol has been in short supply in the last season as we went in from winter and now we're in spring and we're still having a hard time, you know, with the stocks and stockpile and things like that. I mean, as we think about more folks maybe having an asthma flare-up or things like that, is there a concern that there may be a shortage of medication to treat any sort of acute symptoms?
This is absolutely a concern, and we're monitoring it very closely. We really want to guard against, a hoarding situation, but also making sure our patients have the medications that they need. There are good alternatives, so something to speak to your physician, whether it's your allergist, your pulmonologist, or a primary care doctor, to see if you're a candidate for that. And hopefully the factories will be able to keep up with the supply demands going into the future as well.
And I think that shortage has been for primarily what we've seen or we've heard is the nebulized albuterol that they use in a hospital setting. We haven't quite heard, we will usually hear in our community, but we're a national organization, we're not, local, but we'll usually hear about shortages and we're in touch with like the Pharmacy Association to really understand where these shortages might be. But what we've heard and seen is it's primarily the nebulized, which is, the liquid form. But I think the doctor's absolutely right. We don't want to hoard anything. We want to make sure people understand what it is. And I think if you use, I'm pretty sure if you use a spacer, a chamber, an air chamber with an inhaler sprayed albuterol rescue medication into that chamber, that can work as an alternative, which is, I think, what the doctor was alluding to, maybe.
Yeah, so it's important to emphasize that the nebulizer does not necessarily work better than the inhaled version of albuterol via the inhaler with the spacer. So it can be a very good substitute.
But with young children may not do as well with using the pump and the spacer, correct?
Absolutely, and that's really tough, especially for the really small kids. And so this is where maybe alternative nebulized medications could come into play. Or, at least trying the inhaler. You'd be surprised. Some kids are more adaptable than we give them credit for.
So what's the best way if I'm at home and I'm concerned about this? I might be feeling like this is really an unbearable season, right? So Dr. Wolfson, what should I be doing at home to prepare myself for things getting worse or to continue to treat? If I don't necessarily want to, wait for a doctor's appointment, is there anything I can do at home to help myself?
So there are definitely some lifestyle modifications you can make. The first is actually shutting the windows. I know it's nice outside, but actually keeping that pollen outside and using the air conditioning instead. You also can physically remove pollen from your hair and your skin if you go outside. So taking a shower after you've been outside. And you can use, there are some over-the-counter medications. Of course, ask your doctor if it's okay for you to use those. But there are some very effective medications available over-the-counter, such as, oral antihistamines and steroid nasal sprays that can really help patients.
Yeah. Well, I also want to, Mr. Mendez, talk about the climate change conversation, because as we try to work on solutions as a nation for what that looks like, it's possible that we have to continue to sort of brace ourselves for what could even be a drier and more highly pollinated season.
Yeah, it's funny because people think about climate change, they think about sea level rise, and some people who aren't on the coastline or don't spend time there might not see the impact of climate change. But what we tell people is, there's a direct link here. If your allergies are getting worse, it's because of climate change, the longer growing seasons, the more intense releases of pollen. And I'll just give you an example of how that works. So the first growing season starts in the springtime with pollen releases from trees. But because it's a lot warmer, that growing season starts sooner. So that's how it starts much earlier. Then from the trees, you move to the summer where you have grass pollen. And then towards the fall, you have ragweed, which is the fall allergen. But that fall allergen continues a lot longer because it's warmer in the fall. Usually the first frost kills the ragweed, so they can't pollinate anymore. But because it's much warmer, then the growing season continues. And then you have more intense releases of pollen because of the carbon dioxide. And it's known that carbon dioxide supercharges the release of pollen from plants. So that's how you get more intense releases. And that's the link between climate change and allergies and in our health. And so we, in addition to the things you can do to manage your pollen in your hair and the other things, it's a bigger picture issue where reducing your carbon footprint, being mindful of that is really important as it impacts climate change.
Yeah. Would you also agree with that, Dr. Wolfson?
Yes, very well stated. And also just to say that pollution can worsen asthma itself.
Yes.
So, direct link there as well.
Absolutely. Well, I want to thank you both for your time. Kenneth Mendez is president and CEO of the Asthma and Allergy Foundation, and Dr. Anna Wolfson is an allergist and immunologist at Massachusetts General Hospital. Thank you for your time.
Yeah.
Thank you.